At a clinic, I said, no blackfellas coming there. I said, all right, listen, I'll get on a plane and come and help you organise it. So I went up to Alice Springs, and Fred was there, and he pushed me in the car, and I said, what's the hurry, Fred? He said, I've got to get this clinic going out at the pitlands. He said, that's all right, we'll fix things up. And so I said, can I go down here? He's driving his car, go down here, go down there, and he dropped me at the TAB. He said, you bastard, what are you doing now? I've got you up to help us run this clinic. I said, don't you worry, Fred. He said, what are you here for wasting my time going into the TAB? I said, this is where my mob, I've got to talk to my mob. They got to tell me what to do. I said, you are a barbarian, Fred, and you don't know these things. So anyway, I'll see you tomorrow in the creek, and we'll talk about what my people, what they're going to listen to. Okay? So next day I got him in the creek. I said, Fred, you got to talk to the people. You really have to talk to the people, and you've got to talk to them here in Alice Springs, because they know, that's all relatives out there, and you've got to talk to them and find out how you have to deal with people. They've got a life of their own. And so I sent Fred out with one of my relatives out to the pitlands, and they got him, and they took him out bush, and they painted him up in red ochre, and they took him right way out, and they then brought out their sacred sites, their sacred objects, and they put them down, and they sang their stories to him, and they made Fred stand there and listen to them about their stories and what those objects meant to them. And it changed his life. He was a different man. He went from a barbarian to a blackfella. And that's my relationship with Fred. He's my jamal. He's my brother.
I worked in the Aboriginal employment section of the Melbourne office, and this job came through. Wanted it promoted out in the Aboriginal community. Hello, I said to myself, this looks interesting. And my husband and I, Reg Murray, had not long ago done a trip around Australia, and they were looking for a field clerk and possibly other people to help with the program, and asked us to. We applied. I advertised it for other people, of course, and we applied. And hey, come on! And Fred rocks up one day, and we thought, what a funny bloke. Where's he come from? What kind, It was really interesting, because we were Melbourne people. We didn't know about his reputation or the work that he'd done or what people had educated him about Aboriginal health. So I talked to my mum about it and said, this is going to be a big change if we get it. And my mum was a stolen generation person, and we knew we were going to go all the way around Australia. So we tried really hard to get these jobs, because I knew that we'd find my mum's family, and we did. And what we always did was we worked with respect, and he showed, and we did work with respect by contacting all the right people, and what's more, leaving stuff behind and explaining what we found. That was revolutionary. And for many, many years, White Australia, let me assure you, did not pick that up. And we still have to fight the fight in research and in health research for Aboriginal people to be involved, working towards it, guide these things, and participate as researchers. So it was it was a hard and a wonderful time.
For that whole period, over the 460 plus communities that we've seen in WA, SANT in Northern Queensland and Northern New South Wales. We actually nailed every program, every community that we seen. We made sure that the community was engaged all the way along. I mean, the employment of Aboriginal people there all the way along, that was probably one of the critical parts in the partnerships that allows us to be here today and say, yeah, Fred, we remember you and we're going to continue your work. And with everybody here, I guess, seeing that, that's a huge, big plus, big bonus for all the work that was done from 40 years ago to where we are now. One of the critical things, the first clinic we ran in Port Augusta was at Devonport. It was at Devonport, but I was I think the only Aboriginal person there that worked in an Aboriginal community in the remote areas. I mean, the whole team really brought together. We'd not worked together before. A lot of them hadn't worked in Aboriginal remote communities before. Gabby, you'd remember your first situation when you was at in Dalgna. Aboriginal people was just essential along the way. And to see Fred work in those communities and then watch that he's changed over the years, his demeanour and in the way in which he would speak to people. I mean, I still remember it quite clearly now, and it's one of those real big remarkable things that we as a team all looked at. Everyone looked at that, and we noticed that the way in which that was happening. We also noticed the continual engagement with our elders in the communities and the children. They all become part of the National Trachoma and IELTS program. So a lot of the liaison work was actually done by the people on the ground because the product that we was providing, fixing fixable eye care problems with, with our team, professional team at the time, and that's 40 years ago, it is still remarkable.
It was such an honour, and we went everywhere, places that no one's ever thought of or been to, had been to before, and those places, some of those don't exist anymore. And I'm looking at a lot of people here who've been in a lot of those places with us, and some of our team are here. And it was extraordinary, really, that they were being delivered first-class ophthalmology in the remotest parts of Australia, because we had over 80 ophthalmologists that volunteered from the Royal Australian College of Ophthalmologists. And Fred learnt, no survey without service. So we delivered a really good service. We didn't just measure people and do a record. We actually gave them, really first-class treatment, and followed it up. And I'm looking at Susan there, who made sure the actions happened and the surgical programs happened, and Jeff over there from OPS, and all those glasses we promised people, everything that we said we were going to do for people, they got to them. And I think that was an amazing achievement.
Let me ask you, just to the four of you, right? What's the lesson from the National Trachoma and Eye Health program? What's the one lesson that you would say we still need to hear today? Right? I mean, it achieved enormous things. What's the big lesson?
You just can't recognise Aboriginal people as a people and give them citizenship without also providing the cornerstone for equality. And that's everything, not just health services, but everything. And what still hangs over the top of that is that, when you put letters to words, the National Trachoma and Eye Health program highlighted trachoma as a significant illness. And Fred brought the ophthalmologists right to the feet of an oppressed people that they just didn't even think about before. But they did that, and then there's still this question of how you control the infection, not just provide eye health at the foot of the ophthalmologists or the nurses or the optists. But the infection is still there, and the government is moving away from providing legal services, providing health services, and highlighting the history of that oppression.
Racism and prejudice is alive and well in Australia, and that really does affect all of us, and we need to fight that fight all the time. And the way that we fight that fight is through education of self, education of our families, and education of our workplaces. When we travelled, we saw some of the most skilled Aboriginal health workers that we had ever seen, and some of the most downtrodden Aboriginal health workers. A very, very big difference. When those Aboriginal health workers had the support of those senior medicos and were respected, both culturally and intellectually, they did very, very well and could really do a good service for their mob. So we need to create those situations, support those health workers, and look at ourselves and look at the public, our policies and things like that, to make those workplaces really make a big difference to Aboriginal health.
Thanks, Rose.
In those days when we were working 40 years ago, we didn't even have one Aboriginal medical graduate. There was no Aboriginal kids going to university. There was none doing any nursing. There was none doing medicine. And I always remember Fred, when he first met Mick Miller's daughter, Lydia, that he said, "I want you to be the first Aboriginal doctor." She actually ended up in film. But seriously, today, I don't know what the stats are at the moment, but there's 240 medical Aboriginal graduates. You know, that is just a wonderful achievement. But you think of that in only 40 years, it's not very many people really. We're just sort of on the way to get maybe a few Aboriginal, you know, other specialties involved in ENT and in ophthalmology and a few other parts. There's some other people who've specialised in areas. You know, that is a big change, but it's taken 40 years to do that. I think that's pretty slow. So, but one of the things that I think that we've done is we've had, I think many of those communities, we've had the opportunity for those communities to trust and know that we absolutely mean what we say we're going to do.
I recall clearly is a number of Aboriginal medical services that we actually initiated and established along the way. Our first one, of course, being a phone call to Naomi in Redfern here back in May 1976 when we had finished the clinic at Port Augusta, and it was Fred that says, "Naomi, get your butts over here. We need a doctor here to set up our first Aboriginal medical services in Central Australia, or not Central Australia, it was Port Augusta at the time." So that was the first one there. Which now we have the Pickawea Medical Services, Aboriginal Medical Services is current nowadays there now. Along the way also there's Gunapa Health in the AP Wildlands, Geraldton Medical Services, there's Bream. So there was quite a number of those initiatives that came about by, I guess, the whole involvement of the National Trachoma program, the professionalism from the ophthalmologist and medical side of it, working alongside with the Aboriginal community to make sure that those upgrade of health and eye care services continues. We still got a long ways to go as yet, you know, and that's probably why people like us here, we're not going to give in. We're going to come back. We're going to be here tomorrow, and we'll still ask those questions about how can we improve those health services in those remote areas. What do we need to do? You know, we're not going to give up. We're going to still keep going.
Terrific.